HIV is a virus that attacks a person's immune system. Most people get HIV through anal or vaginal sex or by sharing needles and other drug injection equipment with a person who has HIV. HIV can also be passed by a pregnant woman to her baby during pregnancy, childbirth, or later through breastfeeding. Without treatment, HIV can make a person very sick or even cause death. The only way to know if you have HIV is to get tested. Knowing your status can help you make healthy decisions. To prevent getting HIV, take medicine called PrEP if you're at high risk. Always use condoms or clean needles, never share needles, or choose not to have sex or inject drugs. If you have HIV, get in care and take HIV medicine as prescribed. With the right medical care, you can live a long, healthy life and prevent transmission to others.
Good morning, viewers. You're welcome to today's segment on Health Corner. Today, we'll be talking to you on the topic living with HIV and AIDS. I'm your host, Udofia, and with me here in the studio, I have my co-presenters.
Abasifreke Jacob.
George Ibok.
Akwa.
Thank you for being with me here in the studio today. You are welcome to today's program. As we all know, germs generally cannot be seen through the naked eyes, but through a microscope. It takes a series of tests and symptoms that show on the body of an infected person to detect its presence. HIV and AIDS is a virus that can be transmitted through various means, ranging from sharing of sharp objects, blood transfusion, sexual intercourse, and the rest of it all. All right, to my co-presenters, let's hear a thing or few you would like to say on HIV and AIDS.
Yeah, it's talking about HIV and AIDS. Let's talk about the misconception part of it. You know, so many people have actually talked about things that are inaccurate about HIV and AIDS. Like, I can remember some time ago, I posted on my WhatsApp page, when last did you go for a HIV checkup? Do you know your HIV status? People came to my DM and they were like, Abbas, what did you do? Where did you go? And it was as if it's only through unprotected sex that one can contact HIV and AIDS. No, that's not actually true. One can contact HIV and AIDS through blood transfusion, sharing of sharp objects, and unprotected sex too.
Oh, okay.
Yeah.
All right, to you, Mr. George Ibok.
All right, thank you very much. HIV and AIDS is one of the deadly viruses that is ravaging the world. And it has really affected the third world countries. Even the first world countries have also been affected. But I believe that the government alone cannot solve that problem. So there should be room for private sector participation. Okay. The private sector should come in by initiating intervention programs, providing incentives for those living with the virus. So by so doing, it will go a long way to build and strengthen their believability that being infected by the virus is not the end of the road, that they could still be useful to themselves and then contribute their quota to the development of their countries. After all, the virus affects the immune system, not the brain. Yes. So your intellectual capacity is still intact. You can still grow the economy. You can still contribute your quota to nation building. I think that's what I have to say.
Okay, that's actually a nice one from Mr. George Ibok. All right, Ceci, can we hear what you have to say on HIV and AIDS?
Okay, thank you very much. What I have to say about HIV is HIV/AIDS is not a killer disease as per. But what I've noticed is since the arrival of COVID-19, people have actually neglected going to check up for their HIV status to know where they stand. So that's what this show is going to focus on. We are going to talk about the preventive measures, the ways you can acquire this HIV/AIDS, and lots more. Thank you very much.
That's a good one from our presenters. Stay tuned with us. You're going to learn a lot more. So we have a guest in our midst today in the studio who would be introduced after the short break. Do well to stay with us and do not go anywhere. If you do have a question, we have our WhatsApp contact displayed on your screen in front of you. Do well to send in your messages to our WhatsApp. Please stay tuned. Welcome back, viewers. Thank you for staying with us. Today we have in our midst a health specialist, pharmacist, Ekerete Anthony. Welcome, sir, to the studio.
Thank you very much.
Good to have you here.
Good to have you too.
I'm sure our viewers and everyone in this segment are going to learn a lot from you. All right, sir. Please, can you tell the viewers more about yourself?
Okay. I am pharmacist Anthony Ekerete, a health and medical practitioner. I have a private firm known as Udofia Pharmacy, and there I'm doing my private practice, also known as community practice. I'm from Akwa Ibom State, precisely Ibom local government. Okay. My pharmacy is located at Ikot Okoro Road, Abak here, quite close to the campus here, school campus, 103 Ikot Okoro Road. And the name of the pharmacy is Desha Pharmacy.
All right, viewers, Delta Pharmacy is located at Ikodokoro Road, Abak. Do well to walk in for your medical checkup. All right, sir, please, can you enlighten the audience more about HIV and AIDS?
Thank you very much. Actually, HIV is human immune virus. It is not the human immune, it is not the virus that kills, rather it's the AIDS itself, the CD4 count.
Okay.
So people living with HIV, aside the stigmatization, it is a CD4, when it gets to the stage of AIDS, acquired immune deficiency syndrome, that is actually what kills people.
Okay.
There are so many factors that one can contract HIV. People believe it's only through sex that one can contract HIV. Of course, no. Like ladies, they do go to the salon to make their hairs, and most of you girls don't carry your tools, like the needles, the pins, and even the guys, they go to the barber salon to cut their hairs. They don't carry their clippers. Even when they get to the salon, they don't ask the barber to sterilize the blade. Most of them don't even care to sterilize, because if you use a hot fire to burn the clipper, to burn the blade, there's no how the virus will survive under a hot flame. If, for instance, I get to the salon to cut my hair, I have HIV, and the barber had to shave my hair and eventually cut my flesh. And if it doesn't, and I leave the salon, and if it doesn't sterilize the blade immediately and use it on a person, the tendency of the person contracting HIV is there. And the next person coming to cut the hair, if actually his immune system is not up there, is not high enough to resist this virus, the person has acquired the HIV. So the general belief about HIV is that people get HIV through sex, which is totally wrong. Another aspect, another agent of acquiring HIV is using of already used syringes and needles to administer injection to a patient. Maybe you are working in a health center or a pharmacy or a chemist or a hospital. You see a patient, you introduce a needle into his flesh, and probably you may not have conducted a test on the person, and immediately another person comes in. You use that same needle and give the person injection. It then from me that if Mr. A had HIV, you've transmitted it to Mr. B, which is very, very bad. Another route is blood transfusion. That is why when you get to the hospital, maybe you are anemia, you are anemic, and you are asked to donate blood. They start looking for someone, a donor, and if a donor comes, they must insist that you should go through several tests tests like hepatitis B, HIV, your blood group, your genotype. But since we are embedding on HIV today, we are going to talk about HIV. Because if you are tested for HIV, or if you are not tested for HIV, and you go ahead, maybe to save life, and the doctor rushed and take your blood, probably the blood they took from you and gave to that person that was sick or down, probably you've transmitted HIV to the person. Why? Because the person needed to survive. And in the process of surviving, you've injected another infection into the patient. The patient will now be battling with how to get out of anemia and how to survive HIV.
So you talked about immune system. Is it that someone with a high immune system is at low risk of contacting HIV and AIDS?
Thank you very much for the question. Actually, someone with high immune system has a very big chance of resisting the acquired of HIV, because one, for you to build, you have to build your immune system. It's not only HIV that you can prevent. Okay, take for instance, we live in the same room, but you keep treating yourself on malaria. The same mosquito that bites you is the same mosquito that bites me. But my immune system is high, yours is weak. The tendency of you having malaria, because my immune system is very high, or yours is weak, the immune system will suppress the parasites. My immune system will suppress the parasite, but if your immune system is low, any little sickness, it is called opportunist infection. Any sickness that comes your way, it will infect you, and you feel the symptoms just because your immune system is low and it's not being able to resist foreign bodies.
Okay, so let's talk about stigmatization, which is very common in our society, where we get to see with people infected with HIV and AIDS being deprived of so many job opportunities. Most of them go through depression, most of them go through hard times. As a health specialist that you are, and we know very well that you've actually attended to several cases of HIV and AIDS, how do you think the people living with HIV and AIDS manage stigmatization?
That's a very good question. Because as I had earlier said in my introduction, it is not the virus that kills, rather the stigmatization. And how we can manage stigmatization in our environment is solely depend on the person that has the infection. First and foremost, you define it if you want people or your parents or your spouse or your loved ones to know if you have HIV. Another person, you must have a confidant, no matter what. Someone you confide with. At least, if not your parents, your best friend, your closest person. Say, please, this is someone that has my interest, and I have to confide in you. So once in a while, the person will be, you call up the person should be checking on you, engage in talks. The person will be taking you to functions. It can even encourage you to be organizing a seminar on HIV patients and talk to them that it doesn't kill. So many sicknesses kill more than HIV. Sicknesses like hepatitis, sicknesses like hypertension, sicknesses like diabetes. It is better for me to have HIV than to have diabetes. When you create that awareness and knowledge to them, the stigmatization will gradually, it's a gradual process. It doesn't just go immediately. The stigmatization will just gradually erase. So it is good to have a confidant, someone you can be confiding with and be attending seminars and exercises, engage yourself in exercises and stop shows so that you can wear off the stigma.
All right, sir. Still on the issue of stigmatization, I want to narrow it down to the Nigerian campuses. You know, when it comes to our Nigerian campus, people who tends to be the infected patients living with HIV get stigmatized a lot. People the students, most especially, will make them feel as if they are the worst people. They are going to die anytime soon. So I want you to tell us, as a medical practitioner that you are, the ways in which this stigmatization can be reduced in Nigerian campuses.
Thank you very much. Stigmatization depends. That is why I say it all depends on the person that has the virus. If you want to trumpet it, to amplify it, that you have HIV, it's all left for you. If you want to have a confidant that, this is someone I can run to anytime, any day. The most important thing for you to do is to be taking your drugs. If you take your drugs, you will live healthy. That is the most important thing. Once you discover that you have HIV virus, you have to be taking your drugs consistently. And thereby, your immune system will be up. Opportunist infection wouldn't come in because there's something we call systemic lupus erythematosus. Once your immune system is down, the opportunist infection will come. Like you start having rashes from your body, you start having diarrhea, you start having cough, you start having some balls, you start looking pale, you start looking as if you are finished in the world. When you have all those sicknesses in you, your mentality, you will be depressed. You will definitely be depressed. And once you are depressed, people will start rejecting you in the society. So that is where stigmatization comes in. So you have to guard against all those factors.
Because of the quest and passion to come up with the drugs that can cure HIV and AIDS, some persons, especially Africans, have gone into research, has gone into research to see how they can come up with the drugs that could actually cure this virus. So a lot of herbal supplements has been discovered, supplement made from natural herbs. So sir, please, I want to find out, can herbal supplements cure HIV and AIDS?
Thank you very much. With my knowledge and the years of practice in pharmaceutical, I know drugs are gotten from the plants, roots, but it is being refined before shelving them. If someone comes out to tell you that he has a cure for HIV, well, it has not brought it to the open. I wouldn't discriminate. I wouldn't discourage that. But I'm yet to know the cure for HIV. It's not yet being thrown to the open that there is this particular drug or this particular herbal drug is good for HIV. Moreover, herbal drugs, I'm not condemning it. They are good. But when taken in large quantity, it can cause what is called liver cirrhosis and kidney failure. So you have to be careful when dealing with herbal drug because you don't know the dosage. Quite unlike the conventional drugs, you know the strength of the drug, which is in milligrams, it's in milligrams, so you can measure it and take as prescribed by a physician. Talking about herbal supplement or herbal medication for curative aspects in HIV, I'm not aware of that.
Okay, sir, because of the high level of stigmatization in the country, some persons will want to maintain that high level of privacy, wouldn't want a third party when they are doing their HIV test. But it is collectively believed that the hospital environment is the most suitable environment to do your HIV test. Sir, can we see how accurate in-home HIV tests? Can we still have the suitable result when doing our HIV tests apart from the hospital environment in our houses?
It is better, it is always advised that every 3 months we go for a checkup, HIV checkup. Because pre-exposure time is 3 months, window period. It's called window period. When you expose yourself to maybe unprotected sex or expose yourself to the salon that is not properly have a sterilization unit, You can say, okay, please let me just take myself to the hospital or a health sector to run a test. But if you are the kind of person that maybe does not want people to know about your status, you can go and purchase the 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 test strips in the pharmacy or hospital, or you preferably you go to a hospital you are not known, you go to a place you are not known and run the tests. Because if you feel that maybe if you go to a place you are known, they will amplify your case of which is wrong, there's a doctor, a trained medical practitioner wouldn't do that, because it's against our ethics, it's against the oath we took. We don't disclose any element to any apart even your husband, to anybody. Don't disclose it to anybody. Even husband and wife comes in here to my pharmacy or my premises to run HIV tests, I will excuse them, the wife, say, please, can you stay outside? Let me run a test for your husband. It will be now less for you, the wife, to tell your husband that I have HIV. It will be from me. You advise the wife, maybe tell your husband. What you do is advice. You tell your husband that you have HIV, that this is how we are going to live now. You have to start taking your drugs immediately. And you have to start having condom during our sexual intercourse. Because I've seen so many husbands, so many couple. One will be reactive, one will not be reactive. So what we do, you advise them to live on condom. So for the people that wouldn't prefer to be tested in their local community, I will always advise they should go to where they are not known. But the main thing is for you to be going for checkup every 3 months if you are exposed to unsterilized objects or unprotected sex. Another way you can contact HIV, maybe you have an open wound. Suddenly your friend had an accident. You rush to help the person. If your friend had an HIV and the blood spilled on that wound, definitely you're going to contract it. You're going to have it. There's no two ways about it. So there are so many ways. And if someone has HIV, you are kissing the person has wound, and eventually you dip in and the wound gets into your mouth and the blood gets into your mouth. The tendency of you having HIV is 100%.
That's interesting. I'm actually learning that for the first time.
There's no two ways about it. Once blood comes out, there is on the fluid that can lead to HIV transmission.
Wow, I've learned so much more from this program, and I'm sure our viewers out there are learning so much more too. At this moment, we'll be going on a short break where we'll be hearing from our viewers what they have to say on HIV and AIDS with our correspondents, Blessing Innocent and Ernest Norma. Stay tuned.
Good morning, viewers. My name is Innocent Blessing. We have few persons to ask questions on HIV and AIDS. Sit back and watch. Your name, please?
Ilakimifa Olga.
Please, when last did you go for your HIV test?
That should be about 3 months ago.
Yeah. Okay. So how often are you supposed to take a test?
Regularly.
Okay, thank you. Please, does HIV reflect on the human skin?
No, I don't think so. No, it doesn't.
Why?
Because HIV is a virus and it runs in the blood. It's something that can be seen outside. It can be seen.
Good morning. Please, your name?
My name is Joseph Eshet.
Okay, Joseph Ishet. Please, when last did you go for an HIV test?
That was last month.
Okay, how often are you supposed to take an HIV test?
Within the interval of 3 months, you should go for your test.
Okay, thank you. Okay, so please, I would like to know what's the difference between HIV and AIDS?
HIV is not a killer virus. It's not a killer disease, but AIDS is a killer disease. It's a killer virus. You understand? And then HIV is the first part That's the first part of the virus. That's the starting process. And then it develops to AIDS, and then AIDS is the killer virus.
Thank you very much. My name is Carlos Hennis Norma, and I'll be going into the field to ask people if they know the meaning of HIV and AIDS. So please come with me. Hi, good morning. What's your name?
My name is Anyedi Yang.
Okay, so I would like to ask you a question.
No problem.
Okay, so please, what's the full meaning of HIV?
HIV means human immunodeficiency virus.
Okay, thank you very much for your time. Hi, good morning. What's your name?
My name is Aneke Milford.
Okay, so I'll be asking you a question, and can you please give me an answer to it? Okay, so my question is, how do you contact HIV and AIDS?
Okay, HIV/AIDS can be contacted through unprotected sex, using of unsterilized sharp objects like clippers for the guys. They go to the salon without their own clipper, and then the one the barber uses for them is not sterilized.
Thank you very much. Thank you very much for your time.
Welcome back, viewers. Thank you very much, Blessing and Hennis Norma. That was a nice one. All right, sir, still on the topic living with HIV and AIDS. I have a question. Sir, please, from my research, I was told that there are drugs a patient can take, and with time, this HIV virus gets shrinked in the body of the person, that it becomes impossible for the person to transmit the virus to other persons they come in contact with. I don't know if this is factual.
It's all right. There are drugs. Once you get registered, it is the government that will give you the drugs. And the drugs are actually expensive, but it is the federal government through World Health Organization that subsidize the medications for patients living with HIV. Therefore, when you are living with HIV, there's a drug, it is lamivudine, stavudine, and nevirapine. When you take this drug, it will help suppress the AIDS, thereby upping your immune system. And that symptoms, HIV symptoms, will not show once your immune system is being suppressed. And how do you do it? By taking this particular drug.
All right, sir, away from stigmatization, how long does it take for a person to know that he or she is infected with HIV and AIDS?
Thank you very much. HIV, pre-exposure. For instance, you have a partner, or you just met this person. You have fun with the person, or you went to a place and have it cut, or have your hair fixed, and you are not sure of the equipment they used. You get back to the house, or you help someone, an accident victim, or someone transfused the blood to you, and you are not sure if the person had this virus, or the object you used had this virus in it. So what you do, you wait for 3 months. After 3, or what you do, you start go and register in the health sector. That, I had an unprotected sex. I'm not sure of this person. Blood spilled on my body. I went to a salon to make my hair, and the needle pierced my head. I'm not sure of the needle. Please, this is the situation I've found myself. There's no registered hospital that will not attend to you, and they will start giving you treatment immediately. And they will give the drug to take for like 1 month, 2 weeks. Then after 3 months, you go back and repeat the test. If after 3 months, the virus does not manifest in your body, it means you're free. But if after 3 months, the virus manifests in your body, it means you are in there. And what you have to do is keep taking the drug.
All right, sir, this question just popped into my mind now, and I feel I should ask because there are so many people that are out there to learn. There are cases of people visiting a particular test center to get tested of HIV and AIDS, and they will come back with a result that they are HIV negative. And then they'll visit another HIV test center and then we realize that they're HIV positive. How do we reconcile these contradicting results?
Okay, thank you. It's a good question because I've witnessed that in my facility, like 2 persons, they went for a test. There's what we call confirmatory tests. They went for a test and it showed negative. Well, when they came to my facility, it was positive. And what I did, I had to send the person to a hospital, to a general center, a collective center, which they will do the confirmatory test. And when they did the confirmatory, it was positive. That showed that the process they used in doing the other one wasn't correct. And if you have HIV and when you go and do tests and the result shows negative, it means you are endangering your immune system because you wouldn't know. It is something that one has to be very, very careful when conducting HIV tests. You have to be sure of your kits that you are up to date. Because once you tell a patient that you don't have HIV, whereas the person has HIV, it means the person will go back and live his normal life. He or her normal life, which is not good. So you have to be sure of your kits. You have to know how you are doing the tests.
All right, sir. We've actually learned a lot from you concerning ways in which HIV/AIDS could be acquired. Now we want to focus on the preventive measures. Still in this Nigerian campus, I want you to tell us, because it's common among the students, one cannot be too careful in this life. So we would like you to tell us about the preventive measures in which we can reduce the spread of HIV among students in the campus.
Thank you very much. The measures, like in Akwa, initially it was Benue State that had the highest population of people living with HIV. But currently, the statistics shows that it's Akwa Ibom State that has the highest number of people living with HIV. In a school environment like this, it is always good to maybe have a health personnel coming from time to time to talk about the measures, the do and don'ts of ways of contacting HIV. The number one thing that comes into people's mind is sex. Of course, we try to convince people that it's very, very raw. It's not only sex. Once you have your needle, maybe, or this aboki, these Hausa guys that do go around cutting nails, eventually they cut someone and they use that same equipment on you. And the tendency of you having HIV is very open. So for you to prevent HIV, when you are going to the salon, go with your kids, both male and female. Then when you are meeting your opposite sex, use condom. And when you are kissing your fellow person, if you notice the person has wound, there's what they call oral thrush. If in guys, it's called candida balanitis.
Okay.
When someone is talking, you start having some white patches here. It is called oral thrush. Then when you notice that person, the person may not live with HIV, but it is 95% indicate it's 95% shows that study shows that 95% person living with HIV has candida balanitis. So when you are looking at someone that is talking about, you just avoid that. And another way is anal sex. You can get it through anal sex very, very easily. Then another way is helping, if we must help an accident victim, use protective measures. Use your gloves, long sleeves, and make sure you don't have wounds on your body, because if blood gets into that wound, definitely it will get into your system and you will contract HIV.
This is getting interesting. We have WhatsApp questions coming in, and I'm sure our viewers would like to get their messages, their questions being attended to. So we have a question from Jones from Eket. He asked, is it possible for HIV to be transmitted from a pregnant positive mother to an unborn baby, that's a fetus?
Thank you very much. Sorry I didn't touch that. There are some mothers, when someone is pregnant, it is expected that you keep taking your HIV drugs. You'll be given HIV drugs. It does not cause teratogenic effects to the baby. It will not affect the baby or deformity. Let me use simple language. Deformity. Sorry. So you keep taking your drugs. Once you take your drugs, it will suppress the eggs, thereby not allowing it to transmit to the fetus. But if you don't take your drug, the tendency of you transmitting it to your fetus is very high. So when you give birth to your child, the child comes out with HIV, and that particular day, they have to start the child with HIV drugs on the first day.
To take another one, Ibama from Uyo Abak Road asked, is it possible for a husband to be positive and the wife is negative?
Thank you very much. My friend, a medical doctor, he just left for UK about last month. Though he divorced the wife like 3 years ago. The wife was positive and they have 2 kids. The guy knew that the wife had HIV, but they were still meeting. Along the line, the guy said, no, he can't do it again. Hence, he's negative, but the wife is still positive. So the guy is negative. Every three months, the guy was going for series of tests, and what the guy did was he was taking supplements to boost his immune system. You know the highest immune booster we have on earth are natural foods, and they are seafoods. So the guy was engaging in seafoods, and it really helped his immune system, and thereby stopping him from contacting the HIV. So people living with husband and wife, one of them can have HIV and one of them cannot.
You spoke earlier about mosquito and its mosquito transmitting malaria. I'm sure we all know, and we have been taught from our primary school days and up to now, we know the ways mosquitoes suck blood and then transmit malaria. But it beats to our imagination that this same mosquito sucks blood from an infected patient. Is it possible that the mosquito does not get to transmit HIV and AIDS to another person?
Mosquitoes carry parasites. HIV is virus. Virus does not survive in mosquito for more than 1 second.
To take my last question, sir, looking at the high rate of unemployment in Nigeria, Akwa Ibom precisely, is it possible for these infected persons with HIV, without being stigmatized or shoved away, is it possible for them to gain employment in the labor market?
The chances of getting employment, it all depends on the employment sector, because there's a place you go for interview, they require your HIV test kit result. It is not written on the face. Once you take your drug, you'll be looking healthy. You look healthy. It all depends on the sector. If you go to ministerial jobs like ministries, I don't think they require that. But if you go to all sector, it all depends on where you are going to seek for employment. They would definitely, of course, if you are traveling out of the country, they wouldn't ask you HIV status. They wouldn't ask you that. You are HIV. For now, I don't know. I don't know how tomorrow will be. There are some countries we enter. Some countries may ask, some countries may not ask. But we are going in for employment. It all depends on the sector.
We have come to the end of today's segment on Health Corner. Sir, please, can we hear your last words to the audience on living with HIV and AIDS?
Thank you very much. What I will advise mostly our young boys and girls in the society, when you are engaging in relationship, try as much as you can to avoid premarital sex. If you must go into sex, you have to acquire all these preventive measures like the use of condoms. And when you are going to the salon to make your hair, you have to go with your tools. If you're a guy, go with your clipper. Or if you don't have a clipper, insist the barber to use bleach and sterilize the blade, or burn it with lighter. It's a source of sterilization as well. Methylated spirit would not kill virus, but bleach will kill it immediately. So if you are helping an accident victim patient, please make sure you get yourself before helping the person. By so doing this, you reduce the rate of HIV in the society.
To my co-presenters, let's hear your last words on living with HIV and AIDS.
Okay, viewers, we believe you've heard so much and you've learned so much from the pharmacist. Go for regular checkup, know your HIV status, say no to stigmatization, and spread love.
Thank you. Okay, to you, Judge Ibom.
My dear viewers, you have just heard from the pharmacist. All you have to do is that you have to be cautious about the way you relate with things and people around your environment. Do well to go for HIV test after 3 months. By so doing, you'll be able to know your HIV status. Thank you.
Okay, Tessie?
All right, viewers, we've learned so much on living with HIV. So please do well to take all the preventive measures into action. Stay safe out there and always go for your medical checkup to know your HIV status. Thank you.
To everyone out there, I hope we would all adhere to the safety measures on living with HIV and AIDS. Do well to stay safe. To those who participated and to making this program a success, thank you for staying with us. And to my co-presenters, thank you for coming to today's show. Thank you for your contribution. Tune in same time next week. I remain your host, Udofia Afia. Thank you very much and do stay safe.